Ladies and gentlemen, I would like to show you some clinical cases. We had a wonderful overview by Dr. Cochran, and I will focus only on potential applications in the daily practice. And in fact, we have three main indications for the application of enemymatics proteins of Emdogain. One is the intrabony defect. It's a defect in the bone, as you have seen it previously. Or we can have defects among the root with a furcation defect, or a kind of recession defect when we lose soft tissue. And let me show you one typical case. It's a deep pocket. You can see it here. And we have the pocket of around 10 millimeters, which means that we have loss almost until the apex. And of course, this tooth is in danger to be lost, because you can observe the tremendous bone loss in this area. So, by using Emdogain, we have the possibility to apply a kind of viscose material on this root surface without having a problem with a lot of tension in the soft tissue. So the step-by-step procedure is as follows. We have the conditioning of the root surface. We place the so-called press gel, which is an EDTA, in order to remove the smear layer. And then we apply the product. You can see the product is a kind of viscose material and is well accepted by the body. Right away we close the flap and we wait for the healing. And this is one case which was followed up to 9 years. And please observe, this is the depth of the pocket at the baseline, around 10 millimeters. And at 9 years, we have a pocket depth of around 2 millimeters. So we have gained around 9 millimeters or 8 millimeters. And then if you have a look at this X-ray, please have a look at this bone loss. This is the dark spot here. And at 9 years, we have a stable situation, and the entire depth of the intrabony component has been filled with new tissue, with new hard tissue. And that means that we were able to stabilize the situation in this patient, and we have kept the tooth. So let me show you also some long-term data with other patients. Look at this case. Extremely deep pockets up to the most apical part of this root. And if you go to implant congresses, you will see that these teeth are taken out by many colleagues. However, with Emdogain, we have the possibility to preserve these teeth, to regenerate the lost attachment and the bone, and you can see the situation at 9 years. And we were even able to place a bridge work on those teeth. So this is a very important finding. And then we have also data up to 10 years. So it's a product which Dr. Cochran very well pointed out. It is evidence-based. And I think that in the regenerative literature, in periodontology, it's one of the best documented materials we have actually. Please observe this tremendous bone loss in this area. Application of Emdogain. Of course, it is very important that the practitioner has enough skills to perform the surgery. It's very, very important. Situation at 3 months, and this is the situation at 10 years. So all these teeth were preserved up to 10 years, and you can see that these intrabony defects are filled up with new tissue. So this is a very well-documented indication. And another example, very deep defect, and you can see a complete field of this defect. And if you compare the preoperative situation with the situation at 10 years, it looks quite stable. So 10-year period, it is a very long time in dentistry. So sometimes we combine it, as Dr. Cochran pointed out. So in order to stabilize the blood clot and to gain even more bone support, we use different kind of grafting materials. And we have a lot of literature supporting this. I don't want to go to details. But look at this case. It's in fact one of my friends, and I have done this surgery to save his canine. And this pocket was 12 millimeters, and we added Emdogain with a bone graft. It was a live surgery I did, and you see the situation as 5 years. A quite nice feel, and this guy was able to preserve his tooth. And this is one case of another patient of mine, preoperative situation illustrating tremendous bone loss, and this is a frontal tooth. If he loses this tooth, it will be a problem. And look at this case, Emdogain and a graft after 11 years. So it means that it is really a combination which leads to tooth preservation on long-term basis. Well, please observe this case. A very deep intrabony defect, and here we have also a loss of the bone between the roots, so-called furcation involvement. And in these cases, the treatment usually is extraction or a kind of resective approach. That means we cut one of the roots, but then the tooth is not anymore that stable, and we have to perform a root canal treatment. With this combination of Emdogain and the graft, we have a stable situation